Welcome to the Workplace Violent Incident Online Reporting System for Hospitals. Cal OSHA has developed a series of 6 online tutorials to help hospital administrators and staff submitting reports understand the system and how to use it. In this module, we will briefly cover the problem of workplace violence in healthcare, the requirement that hospitals report incidents of workplace violence to Cal OSHA, the purpose of reporting, and how Cal OSHA will use the information collected. Healthcare workers are at an increased risk for being physically assaulted on the job by patients, family members of patients, and others. The National Institute of Occupational Safety and Health reported that the incidence of workplace violence is 4 times higher in healthcare workers than for all private sector industries. In 2014, the governor signed Senate Bill 1299. SB 1299 requires that Cal OSHA develop a regulation to prevent workplace violence in healthcare settings. In October 2016, the Standards Board adopted the regulation Workplace Violence Prevention in Healthcare, Title 8, Section 3342 of the General Industry Safety Orders. Workplace violence prevention in healthcare is a comprehensive regulation and covers many employer responsibilities. For information on all employer responsibilities under the standard, please visit the Other Resources section on our Hospital Workplace Violent Incident Reporting webpage. The link to the webpage is available in the video description below. The new regulation requires covered healthcare facilities to develop a plan for preventing violent incidents in their facilities and document and maintain a written record of any violent incident, often called the log. In addition, certain licensed hospitals are also required to report to Cal OSHA violent incidents that occur in their hospital. This and the following tutorials focus on the Workplace Violent Incident Online Reporting System developed by Cal OSHA to receive reports from hospitals. The purpose of reporting incidents to Cal OSHA is threefold. For the first time, Cal OSHA will be able to describe the size and severity of the problem in California, as well as where and when it is occurring. Second, it will allow Cal OSHA to identify work factors that might contribute to the occurrence of workplace violence in hospitals. Third, Cal OSHA will be able to use this information to make recommendations to hospitals on how violence can be prevented. Cal OSHA has developed an online reporting system which collects the minimum information necessary to describe the problem and make prevention recommendations. The system also makes it easy for hospitals to report incidents and for Cal OSHA to summarize and analyze the data. How will Cal OSHA use the information it collects? Each January, Cal OSHA will post on its webpage the total number of reported workplace violent incidents and the names of the hospital facilities that reported during the previous calendar year. Cal OSHA will also provide recommendations for prevention of incidents and may post summary data to help describe the size and distribution of incidents across the state. Individual facilities will not be identified in the summary data. This video provided a brief introduction to reporting of workplace violent incidents by hospitals. Cal OSHA encourages you to view the other Workplace Violent Incident Online Reporting System tutorials for more information about the system. Thank you for viewing this introductory tutorial. See you in the next tutorial.